We presented the results of an individual patient data meta-analysis of over 20,000 women from just under 30 randomized controlled trials that evaluated treatments to the axilla and looked at effects such as local regional recurrence, distant recurrence, breast cancer mortality, and all-cause mortality from these treatments. Trials that have Axillary trials started from the 1950s and before the introduction of sentinel node biopsy, which is the most common procedure undertaken today for staging of the axilla. From the 1990s and the introduction of sentinel node biopsy began trials that started to randomize women to further surgery after a positive or negative sentinel node biopsy, depending on the trial, versus no further surgery. And from 2012 onwards marked the start of trials that started to randomize women to sentinel node biopsy versus no sentinel node biopsy. So the field has changed massively over the last 6 decades. And what we aimed to do was to incorporate all the information from the pre-sentinel node era trials and the sentinel node era trials into one place so that we can provide all of the worldwide evidence in the form of an individual patient data meta-analysis. We looked at oncological endpoints such as local regional recurrence, distant recurrence, and dying from breast cancer, as well as all-cause mortality. But we also looked at morbidity in the form of lymphedema, which has been one of the main reasons or main motivations for these trials of treatment de-escalation in the axilla. We found that lymphedema is substantially increased from women who receive more surgery to the axilla versus less surgery to the axilla. And we found that there was no evidence of a difference in local regional recurrence, breast cancer mortality, or mortality from other causes in those receiving more surgery to the axilla versus less surgery to the axilla. Where we did find quite a substantial reduction was in isolated axillary recurrences. Axillary recurrences are rare. We saw only 55 out of around 20,000 women randomized. However, those women who were randomized to have more surgery to the axilla had approximately half the rate of isolated axillary recurrences than those receiving less surgery to the axilla. Although it's quite a large reduction, it's important to keep in mind that this is a rare outcome, and we didn't see this finding translate into breast cancer mortality, and also to weigh up the fact that more surgery increases the risk of lymphedema, which is morbidity to the arm.